glaucoma is an incredibly complex group of diseases in which damage to the optic nerve inside the eye leads to progressive, irreversible vision loss. The most common type of glaucoma is called primary open-angle glaucoma. This occurs when fluid cannot drain out of the eye properly, causing the pressure inside the eye to increase. This can happen gradually and slowly, so slowly that you may not even experience any symptoms. Despite a lack of symptoms, damage to the optic nerve is irreversible and results in vision loss. Open-angle glaucoma can only be detected through routine eye exams. Another type of glaucoma is called normal tension or low tension glaucoma. This affects a smaller percentage of those with glaucoma. In normal tension glaucoma, the optic nerve is damaged even though the pressure in the eye is not very high.
So what is glaucoma? Glaucoma is a group of eye conditions that damage the optic nerve, the health of which is vital for good vision. This damage is often caused by abnormally high pressure in your eye. It is one of the leading causes of blindness for people over the age of 60. It can occur at any age, but is more common in older adults.
So, some causes for glaucoma are using medications like corticosteroids, increased blood pressure, dilating eye drops, and some are the poor or the reduced blood flow on your optic nerve.
The signs and symptoms of glaucoma vary depending on the type and stage of your condition. For example, for open-angle glaucoma, this includes patchy blind spots in your sight or the peripheral or central vision, frequently in both eyes. Then, tunnel vision in the advanced stages. For acute angle closure glaucoma, this includes severe headache, eye pain, nausea and vomiting, blurred vision, halos around lights, and eye redness.
So, for the laboratory findings, we have done the tonometry, which results show an elevated pressure at 28 mmHg. So, there is also the visual exam that her optic disappears pale and the dip and the size of the optic cap is increased. So for the medical and surgical interventions, we have given the patient Salatan and Timolol eye drop and also Cetamide. And also, there are also surgeries or surgical interventions just like ALT or the argon laser trabeculoplasty, which opens and clogs in your eye so the fluid can drain out. So we have also a SLT or the selective laser trabeculoplasty. So the doctor needs a highly targeted low-level laser at just the spot where there is pressure. So the next one is the laser peripheral iridotomy. So it uses a laser beam to create a tiny hole in the iris so the extra fluid can drain and relieve pressure. And then for the cyclophotocoagulation, so they'll beam a laser into a structure inside your eye to ease the pressure. So for the trabeculectomy, the surgeon will make a small cut in the white part of your eye to take out of some mesh tissue inside. So this helps extra fluid to drain out. So for the drainage implant surgery, so the doctor places a tiny chip inside your eye so the fluid can drain. And the last one will be the electrocautery. So the surgeon will use a heat device called trabectomy to make a tiny cut in the eye's drainage. So it sends the heat to the mesh of tissue inside your eye so it can ease the fluid buildup and the pressure.
For the nursing interventions, first, remember to administer cycloplegic eye drops in the affected eye only. In the affected eye, these drops may precipitate an attack of angle closure glaucoma and threaten the patient's residual vision. Then, After trabeculectomy, give medications as ordered to dilate pupils. Apply topical corticosteroids as ordered to rest the pupil. After surgery, protect the affected eye by applying an eye patch and eye shield. Position the patient on his back or unaffected side and following general safety measures. Administer pain medications as ordered. Encourage ambulation immediately after surgery. Encourage the patient to express his concerns related to having a chronic condition. Monitor the patient's ability to see clearly. Question the patients regularly about the occurrence of visual changes. Monitor the patient's intraocular pressures. Stress the importance of meticulous compliance with prescribed drug therapy. Instruct the patient's family how to modify the patient's environment for safety. And lastly, teach the patient the signs and symptoms that require immediate medical attention, such as sudden vision changes or eye pain.